Hi, I'm Thaleigha Swain. I am 37 years old. I live in Atlanta, Georgia, and I am a healthcare IT consultant. I never wanted kids until one day I did. And I stopped taking birth control maybe in 2009. And around 2016, when I decided I wanted kids, I thought I should get checked because it's been years and nothing has happened. And so I got in with a fertility doctor and we did a HSG. And I found out that one of my fallopian tubes was blocked. And so they immediately told me the only thing that we can do is do IVF. So IVF was the option for us. And finding out financially how much IVF costs, we just paused. We couldn't afford it, weren't there in life yet. And so we just kind of paused. And then we decided we can save for it. Let's save for it. Let's do it. Let's sacrifice to save. And so we started to do that. And then they told me I should have my husband checked. And then he was checked and he had his own problem. I think it's called azoospermia is the name of what he had going on. And so with my block tube and that sperm and the egg were not meeting. So IVF was in fact what we needed to do. And so once we found out that, we just kind of started saving and started IVF kind of maybe like a year later after that. I had my appendix rupture when I was 8 years old. So I had a lot of scar tissue from that surgery. So they were assuming it's scar tissue. When I was younger, I actually had a lot of that going on, maybe in the hospital for a year and a half. So it was very kind of traumatic surgery for me as a young kid. So they assumed that. And then they said there's something called cilia that helps the sperm get to the egg. And maybe I didn't have enough of that or it wasn't flowing like it should. Again, all assumptions, no kind of tests to see if there's too much scar tissue or if there's enough cilia or if it was moving. So kind of based on assumptions. They did do a procedure to try to unblock my tube, but nothing was kind of getting through. It was totally blocked. I had pain at school one day, randomly, just starting of the pain, went to the nurse, and the nurse called my mom, and they thought then it could be an appendix. They didn't know for sure. Went to the doctor. The doctor said, yes, it's probably the appendix. Take her straight to the emergency room. Got to the hospital, and as soon as I got to the hospital, put me on the table, they were able to take the appendix out, but when they took it out, it ruptured over my body. So all of the poison that's in your appendix went back in. So then it was, we need to get this out. We need to get this out. And so I'm from a small town in Americus, Georgia. So they had to transport me to Atlanta, to Eggleston really quickly. Stayed here maybe about 2 months. It was a hard time for our family for sure. Very scary. In 2009, I got engaged to my husband. So I decided to stop taking birth control. I also thought that I had been on it since I was 14 years old, and mainly because of contraceptive, a lot of teenage pregnancies in my area at that time, but also because that I was having some PMS issues, pain, a little bit more pain than I was bearing at that time and at that age. And so my mom thought it was appropriate to go ahead and put me on birth control. I got on birth control pills, and I stayed on birth control pills from my age of 14 until 24, I think. And I rarely missed the pill, maybe 1 or 2, 3. You can count it on one hand. I was very dedicated to making sure I took those. So I just felt like I had taken it long enough, and it's a drug. And so once we got engaged, I just decided I'm just going to stop. We're not going to try to have a baby. We're just going to live our life. I didn't really want kids, but I just thought it'll be fine. And I didn't get pregnant. So it was until I decided I did want kids. I think maybe around the age of 30, 31, 37 now. That's when we decided, let's figure out what's going on. Let's actually try to get pregnant. We started to use some of the apps and different things, but we had some slip ups. So if I was going to get pregnant, I should have been pregnant at that point. And so I decided, I work in healthcare. So I decided, let's just not wait. Let's just go ahead and go to a few doctors, see what they say, and kind of figure out what the plan is. I like to plan. I like to have steps. I want to have a list of things I need to do. And so that made sense to me. Let's go ahead and see what the actual roadmap is for us. At this time, I was dealing with infertility. And so that was hard for me because I was used to getting what I want. I'm a planner. And when I plan things, I work really, really hard to get them done and get them done in a certain time frame. So when I decided that I wanted kids, I thought, okay, I have them in a year or two because I'm planning for it. I'm taking the steps. I didn't have any major health issues at that point besides now having the infertility. But I just thought, even in having infertility, let me research things. Let me get the right doctors. Let me interview and get the right care team to get behind me, and I'll take the steps to do that. But it just was taking longer than normal. My quality of life, I'm a very positive person, but it just took a toll on my confidence because I'm used to being in control, in charge, planning it and getting things done. Our relationship was okay. I think because for so long, I didn't want kids. So I still was just, if we don't have kids, I'll be okay, because I had decided earlier on I didn't have to have kids. My husband has a daughter. She's now 21. So I had kind of been in her life since she was 3. So that was my baby. And then my sister has kids. So I have a lot of nieces and nephews that I'm very active in all of their lives, which is why at some point I didn't want kids. It was a lot. So I thought, that's not the life I want. So I still had kids around. I was still involved. So I was still getting some aspect of parenting on the side, but I was starting to move in a direction where I wanted that for myself. So I just felt a lack of confidence, but I always try, take a day or two, take a week, feel it, make a new plan, and move on. And so that's what I try to do throughout the whole process. My husband had an issue as well. And so it required him to have surgery to kind of see what was going on. So they kind of did a procedure on him. Actually, they did 2 procedures on him. They did one procedure where they went in to see what is really going on. What are we going to diagnose you with? What is your real issue? And so once they did that, they diagnosed him with the azoospermia. And then after that, he had another procedure where they actually went in, got the sperm, and then we froze the sperm. So from there on out, his piece was kind of complete. Like, his piece is kind of done. That wasn't that expensive to us. It was a struggle because he's not a medical person who's going to get a lot of medical advice. He does go to the doctor, but having a surgery was major for him. Having 2 surgeries definitely was a lot for him. But he did it because he now I wanted some kids. We wanted kids together. We have been together for so long. And so he sacrificed and made it happen. They weren't very hard surgeries. He was kind of back up to normal, maybe in about 2 days. But it's still it's surgery, and it's surgery on your man part. So as a man, that's not ideal at any particular time. So, but he sacrificed for us so that we can get where we are today. So it's very, very much appreciated. I think it maybe brought us closer, and he had to learn that this isn't all about me because he had an issue too. So we have to fix both of us. We have to figure out the plan for both of us to make this happen. Financially, this affected us a lot. Doing IVF to me is like buying a very expensive car over and over again. It's very, very expensive. We didn't have a whole lot of savings then. We weren't prepared for something as big. Had some savings, but nothing compared to what we needed for this. So we just really sacrificed, and just even our day-to-day spending, we had to just stop a lot of the different things. We were kind of used to that because we did that to buy a house. So we just kind of continued on and saved a lot. We did have to take out some loans and different things like that. I carried insurance for both of us at my job, and they didn't cover anything, not even the medications. Well, I shouldn't say anything. They covered the ultrasounds. Right. That's it. Some parts of the labs were covered, but none of the testing, the IVF itself, genetic screening, all of the tests my husband had to do, the surgery, the actual IVF procedure itself. None of that was covered. The storage of the sperm, the storage of the embryos once we initially got there, none of that was covered through insurance. And it takes a toll on financials in any relationship at all is a hard thing. So that was one of the biggest things. And when you spend so much money and you have so much kind of vision for what you want and things don't work out each time, it just hurts a little bit more, takes a little bit more of your confidence. So I'm glad we got to where we are today. But financially, it's going to take a toll on whatever it is you have. And it actually doesn't even matter how much money you have. It's a lot of money at one time. We did one full round of IVF. I think maybe with the medications, I'm just going to say $30,000 for the IVF cycle. In that, we ended up at the end with 4 embryos. One of those, though, we found out it was genetically not good. So we just kind of had to discard that one. The first one I got pregnant maybe in 2020. And then I had a miscarriage in October 2020. Very traumatic miscarriage. I was about 6 weeks. I came home and they basically said, you just have to let it pass. But I looked this up. I know for sure, I've never had a kid before, but I know I had contractions to get it out. No medication, no assistance, no help. It's just kind of me and my husband here at home. And he tells people to this day he has PTSD from it because I kind of just told him just to go in the front room, close the door because I'm just screaming. There's nothing he can do to help me. Like there's nothing. Went to the emergency room maybe twice. And the only thing they were giving me was fluid because I'm throwing up because of the pain. I'm dehydrated now because I'm throwing up. And it was just a cycle until finally, maybe like a day and a half of just pain. Finally, they prescribed me some medications, which I'm thinking I could have gotten this a day ago if the pregnancy wasn't viable. Like you can't hurt anything else. They finally prescribed me some medicine and it passed maybe an hour after I took that medication. So it was very traumatic for us. And that was my first time being pregnant. And 6 weeks is early, but when you've been through so much and you're banking on IVF and literally you use the bank for the bag that you have for IVF, it's very, very tough. But as me being who I am, I gave myself time, I grieved, and I thought, you have more embryos. This is why you have more embryos. Grieve it and make a plan and just move on. Learn from it, move on. And so maybe in February 2021, we implanted another embryo. And for whatever reason, we never really got why that one didn't implant, but it didn't implant. I never got a positive pregnancy test from that one at all. So I said, let me take a longer break. I'm just going to take the rest of the year and I'll circle back because at that time, now I only have 1 embryo left. And so maybe July 2021, my IVF doctor, which up to that point, I really liked the doctor, the plans he had gave us. I thought, okay, this is good. It just wasn't meant to be at that point. He retired. Quickly, suddenly, he retired. And I was in tears because my faith was in him. I knew him. I trusted him at that point. And so I thought, let me try not to control the situation, which I always do. So I said, I like the clinic. I like the staff. I like their processes. Whichever doctor they put me with, I'm going to see what that doctor's plan is for us. And so they put me with the new doctor. She was younger. That may have helped. So she had a lot of new things that she wanted me to do, new tests to take, new procedures to do. And one of the procedures she had me do, I had never heard of it in 3 years. 3 years, I had never heard of the procedure. So it's called ERA. Is the acronym they use for it. But it's basically a procedure where they go in and kind of scrape your uterus. If there's any abrasions, if there's any polyps, they kind of test all of those things and they just take out all the stuff that could have came from scar tissue from my surgery, they said after you have a miscarriage, there is debris sometimes from that miscarriage. And I'm thinking, if there could have been debris when I implanted my second embryo, it should have been cleaned up before that, because then maybe I would have been successful with that one. But I can't worry about the past. Okay, I'll do the procedure. We did that procedure and she cleaned up a lot of things. She did find a lot of scar tissue, a lot of abrasions. She found one kind of like tumor, but it wasn't cancerous or anything like that. So we cleaned up a lot of things. And then she said that I had something called endometritis, which is different from endometriosis. Endometritis is inflammation of the uterus. So I'm thinking, well, if everything is inflamed there, that's maybe the reason why I wasn't successful with my first one and that the second one didn't implant. And so once she said that once I get ready to put the next embryo in, we'll do antibiotics before. And I thought, antibiotics, it doesn't sound the best either. But okay, so far she's found out something new. I started in 2016. Here I am now in 2021, finding out something else new about my body. Emotionally, through all of this, I was sad a lot, but I kept most of it in. So I'm used to being a very strong person. I talked about it to my husband only, no one else, not even my mom, my sister. I have best friends. I just talked about it to my husband because I thought, we're in it together, and he's probably feeling a lot of the emotions I'm feeling. I don't cry a lot, and that's mainly because I try to stay stress-free, but I cried a lot during this time. I just would have bursts of just crying, and there's nothing really he could do. He just kind of consoled me, rub my back and different things. Usually after I cry, though, I feel a little better, start over, I regroup. I think I kept a lot of it in. For the most part, I kept most of it in and I always try to reevaluate what I'm doing. How can I make this better? How can I make a better plan? Is it a new doctor I need? Is it a new facility I need? Is it more research I need to do? I've researched a lot and just try to figure out what can I do? What can Thaleigha do? My husband's Derek. What can Derek do to fix our situation or make it better? And not have to rely so much on healthcare these days, because sometimes you have to take it into your own hands. So I learned about the detox now through a random interview that I found on YouTube. They were on The Breakfast Club, Coach Jesse, Dr. Moon. And I listened and I just learned a lot in that hour interview. And so I started following them on social media and just started learning from their small reels, the clips, the Instagram posts, kind of reading everything. And I decided this may be a way that I can take control of my situation. The new issue that I had going on was inflammation. And if there's inflammation in the body, we know that you can control that with what you're eating, what you're putting in your mouth, what you're consuming, I should say, because it could be medications, it could be food and those things. And so I joined one of the group consultations and I listened for one of the sessions. And then the next time I thought, I'm going to stay on here for as long as I need to so that I can talk to Coach Jesse. And I did just that. I listened to great testimonies and stories and questions. I learned a lot from everyone who was on that call. And I got a chance to talk to Coach Jesse and just explain to her what I had been going through. And so her question to me was, how aggressive do you want to be? Remember the exact question. And I said, the most aggressive you have. I have one more embryo. I don't have time for baby steps. Let's do it. And so she recommended that I do the 14-day water fast. And so I didn't delay. I got the kit. Let's do it. We're doing a water fast. She recommended that my husband do it with me, but I wasn't successful. I wasn't successful in getting him to do that with me. He just said, you're stronger than me. I can't do it. And so I decided, at the beginning of the year, it was in December, I think, when I got the recommendation. I ordered everything, so it was here by the beginning of the year. And so at the beginning of the year, I started the 14-day water fast with the kit from their website. And she also recommended after you're done with the 14-day water fast, book a private session with Dr. Moon for next steps before you do anything with your embryo. So I did the 14-day water fast. Day one, tough, very tough. Lightheadedness, dizziness. I threw up some that night. And I thought, oh, I'm not going to make it. I'm not going to make it. Day one was so tough. But the resources that they send along with you, it tells you everything I had going on was normal. I'm supposed to be going through those things. So I trusted that. Let me trust the process. Day two, my cycle came on. And I thought, oh, this is another barrier. The devil is trying to make me quit this process. I don't know if I'm going to be able to get through it. And so I carried on with the plan. After day one, I wasn't hungry during the water fast. I thought about food. Don't get me wrong. Commercials on TV, scents. If my husband is eating downstairs, because he made sure not to eat around me. He ate downstairs. He ate away from home. Go to your friend's house. I'm not grocery shopping. I'm not even turning on the light in the kitchen. And so he's really good about that. But I thought about food. I thought about food around breakfast time. I thought about food around lunchtime and so on. But the kit, it comes with the nutrients that you need. I had coconut water. I had distilled water. I had all the things I needed to kind of feed my body and help detox and clean my body. And so I successfully completed the 14 days with not even a grape, no bite from an apple, nothing. I did it 14 days. And then I did exactly what she told me to do. I booked a private session with Dr. Moon, and he told me to add a few other supplements. In addition to the supplements I kind of still had going on from the fast, I still had some to finish. So I added a few more of the supplements that were from the website. And he said, do another 30 days maybe, and make sure you're following. So there is also a meal plan after the 14 days. They give you what to do the first 3 days, and then it gives you a list of things to move forward with. So I stuck with that. I was very happy in the plant-based eating. I was very happy. I was no longer having to take medications for cycles or anything. My cycles were lighter. I stopped having headaches. Sometimes I would have headaches for no reason at all. I stopped having those. No over-the-counter drugs. I still haven't taken any over-the-counter drugs to this day. And I'm still eating pretty much plant-based diet. And I say pretty much because I'm pregnant. So every now and then I will have cheese on something. So other than that, I followed everything they gave me. I still have the kit now. I still look at that list of foods that I should and shouldn't be eating. Some of the things I had going on before the 14-day water fast was I had really bad cramping, really bad. First 2 days of my cycle was always really bad. I had hypothyroidism, so I was taking some thyroid medications for that, which I only found out that I had that issue while doing IVF. My IVF doctor found that out for me because our PCPs are not running those tests. So that's one thing to maybe ask about. If you think you have a thyroid issue or you know a little bit about it and may want to get tested for it. I was pre-diabetic at some point because of my weight, pretty much BMI. And then once I did the detox, now the 14-day water fast, my cycles were shorter. They went from maybe around 5 days to 3 days. Light, very, very light bleeding. No medications needed. When before I would medicate the entire first day. I would slightly overlap the medication so I never felt cramps. I no longer had to do that at all. It was just like a breeze for my cycle to come on. I got off my thyroid medicine. I still haven't taken that to this day. They keep a very close watch on it because thyroid is something you don't want to have an issue with while you're pregnant. I'm no longer taking that. All of my numbers are really good. I'm no longer pre-diabetic. My weight is down. Of my body, the baby is growing, but I'm not. I lost a total of 19 pounds when I did the 14-day water fast. And I think from the end of the 14-day water fast until I got pregnant, maybe I lost another 7 or so pounds just from eating plant-based and eating smaller meals, kind of portion control and things like that. My pain level was maybe 7 or 8. And then after the water fast, no medications, no pain at all. Just breathing through your cycle, which very rare. No one really breathes through their cycles. So that was, if nothing else came out of this, that was a very good benefit from doing the 14-day water fast. So I would definitely recommend it just on that. Finished the water fast and carried on that particular diet and lifestyle with me. I loved it. And so I decided to implant my last embryo. So I did that maybe the end of April of 2022. And I'm now pregnant. I am 25 weeks as of today. The pregnancy has been amazing. I have not had any symptoms other than slight heartburn. I had no first trimester sick, nausea, vomiting. I have none of that. And I want to contribute that to the fact that my lifestyle changed. My diet has changed. The portions that I eat has changed. What I'm eating has changed. I have a list of approved medications for pregnancy. I'm not taking any of that medication. If I have some heartburn, it doesn't matter what I eat. I'm having it either way. I'm just kind of drinking some almond milk or something like that. It settles it. So I'm not having any symptoms. We're very happy. We're having a baby girl. She's due in January 2023. It's been a very, very long journey for us, but the outcome out of all of that, we will redo all of that so that we can get here. The Detox Now had a prenatal vitamin, the little drops. And so I decided to take that. So I've been taking those drops throughout this pregnancy and haven't had to feed myself all of these pills. I did meet with a nutritionist. She might be a registered dietitian. Okay, I met with someone just to talk about eating plant-based and how I can boost my protein. And so I had someone to just talk to me about different foods I can eat that is plant-based and boost my protein. I'm having to eat 72 grams a day. So I'm staying full. That's probably helping me keep my weight really good. I haven't gained a whole bunch of weight since I've been pregnant. So it's really good. The prenatal vitamin is working fine. It's easy to take. I always remember to take it very early in the morning. So very good supplement to have and not have to take these really big prenatal vitamins because they're really big. So that makes a great difference to me. So the baby's good. She's in a great percentile. She weighs about 1.5 pounds now. The size of the eggplant is what my app is telling me now. We did do a 3D. And so my husband says his genes are strong. She looks like him. Although my family calls her Thaleigha Jr. So we'll see when she comes how she looks, but she is very healthy, not having any issues. I am considered high risk because of anyone over the age of 35. So I'm 37. So I'm high risk for that reason. And also because I'm conceiving through IVF. I didn't take that as a negative. I took that as a positive just because now I feel like I have 2 care teams on my side. I have an OB office and I'm seeing a few different doctors there because it's a group. And then I also have my maternal fetal doctor team that I'm seeing. And I like going to maternal fetal for my ultrasounds. They're very long. They're very extensive. They talk to you about every part of the baby's body. And it keeps your entire mind at ease. And that's very important because of everything I've been through to get here. So I'm really grateful for the team that I'm working with and everyone I've worked with throughout this process, especially Coach Jesse and Dr. Moon. They've been great. They were so excited when I shared the news with them. I couldn't wait to share the news, but I waited. You learn to wait when you do things with IVF and things like that. So I wanted to share it at the perfect time. And so I think I did. And everything's going great. The number one advice I would give to anyone who's going through infertility is trust the people that you're working with, ask questions, and make sure that they're giving you facts. Sometimes facts are better than their personal opinions. You need their professional opinions, not their personal opinions. Get the facts, research it yourself, try to get, backup of what they're saying. And then also be an advocate for yourself. Figure out what it is you can do, what you can change, whether that's with your team or without your team. Always keep them in the know of what you're doing. As I started to work with the detox now, I did let my care team know I'm going to do this. I'm going to be detoxing my body. I'm going to do all these things. And they were totally on board with that. Keep them in the loop. Don't hide anything. And just be an advocate for yourself. Another thing that we're doing, I do have a doula that we're working with to even support me through this labor and delivery process. And so I'm always trying to find a way to advocate for myself and have a bigger support system personally, as well as in the medical field. They always say it takes a village to raise a kid. For me, it's taken a village to get the kid here where I am today. And that's okay. Everybody's journey, no matter how long it takes, it's okay as long as you get the outcome you want. And just try to keep hope and faith. And that has worked for me. And just thank you for listening.